It's not a massive power surge when all the millions of people suddenly log in.
Thinking of adding this to the lights. Good evening, everyone, and welcome to tonight's Performance Scrutiny Committee for Partnerships. Just a little bit of housekeeping before we start. This Scrutiny Committee meeting is being conducted on a hybrid basis in accordance with the Local Government and Elections Wales Act 2021, which will operate alongside the Council's standing orders. The Council's standing orders and Code of Conduct will apply at all times, and members should conduct themselves accordingly. I remind members that this meeting is being live streamed to the public. Please can those attending online switch off your cameras and mute your microphones when you are not speaking to ensure there is no unnecessary background noise. Can I also remind members to ensure that their chat function is switched on and to please use that facility to indicate to me when they wish to speak on a particular item. Please do not speak until I invite you to do so, and remember to unmute your microphone and switch your camera on. A recorded version of this meeting will be uploaded for public viewing as soon as possible after the meeting. Welsh translation of the proceedings will be provided upon request, and the images and sound recording may also be used for training purposes within the council. Thank you, everyone. Okay, should we start with apologies, please, Neil?
Got apologies from councillors Pym, Baker, Westhead, Jones and Whitehead.
Thank you very much. Thank you. Do we have any declarations of interest before we start? No? Okay, so we are going to move the minutes item 3. We'll do that at the end so that we can get onto our only report tonight, which is the Violence Against Women, Domestic Abuse and Sexual Violence Regional Strategy 2023 to 2027. Who have we got here to present this to us this evening, please? Do you want to introduce yourselves?
Yeah. Thank you. My name is Amy Thomas and I'm the Regional Advisor for Violence Against Women, Domestic Abuse and Sexual Violence in Gwent.
Thank you.
And hello, I'm Flynn Madell. Good evening. I'm the Service Manager for Safeguarding in Newport.
Brilliant. And I can see we've got Sally as well. Hi, Sally.
I'm just here in the background as the Strategic Director. Thank you.
That's fine. Thank you very much. Okay, ladies, if you'd like to take it away, that would be great. We are all ears.
Thanks, Chair. If helpful, sorry if I'm shouting, I don't know where the mic is so everybody can hear. If helpful, I can start by taking members through the background of the strategy. So this year,
would be great, thank you.
Thank you. This year, we were required under the Voudersphere Act 2015 to refresh our regional strategy following Welsh Government refreshing their national strategy last year. So towards the end of last year and the beginning of this year, we held a series of workshops across the region with statutory partners, those with responsibilities and obligations under the Act, as well as those in the specialist sector who deliver Voudersphere services. And it culminated in the published Gwent Regional Strategy 2023 to 2027. So there's a bit of context within the strategy as to the findings from the workshops and those sessions during the development period. But what it has led to is for the next 4 years, the region has decided to focus on what we're capturing as 3 fundamentals and 4 specific focus areas. So in respect of the 3 fundamentals, the priorities are going to be around implementing Section 3 of the Domestic Abuse Act 2021. That section specifically references and recognises that children and young people are now victims in their own right if they witness domestic abuse. The second priority under the fundamentals is around regional reform, and specifically within this region that relates to changes with the Public Service Board and community safety are currently going through a review. So it's how we feed into and we weave ourselves into those changes to properly strengthen our governance arrangements in the region for Voudersphere. And the third fundamental is around maintaining the service delivery we've already got, as well as looking at how we can sustain and improve that on a longer term basis for obviously the benefits of victims and survivors. So those three areas were considered sort of core, fundamental to what we need to do in the region. But then in addition to that, what came out of the strategy development was that we need to focus on 4 other priority areas. So the first one is in relation to tackling perpetration, and that's sort of tackling perpetration across the spectrum, across the region. So that covers perpetration by children and young people and adults. It covers perpetration under violence against women, domestic abuse and sexual violence. And it also covers perpetration that on a sort of early intervention and prevention basis, right the way up to serial and serious perpetration as well. The second focus area then within the strategy is linked to children and young people. That tallies with the one fundamental around implementing Section 3 of the Domestic Abuse Act, but there's also continued and renewed focus on educating and empowering children and young people to have healthy relationships and be able to recognise signs of unhealthy relationships and abusive relationships. The third focus area is looking at misogyny and harassment, and in particular how we tackle that, not just within public spaces and places, but also within workplaces as well. So within partner organisations, as well as organisations mandated under the Vowders Free Act. And then the fourth focus area is in relation to being able to support victims and survivors, or have appropriate interventions for perpetrators where there's multiple or co-occurring needs. So that's where Vowders Free doesn't stand alone, and it may be that there's mental health needs, substance misuse needs, or housing, but how we can be more holistic and informed in our approach to preventing, protecting and supporting Vowders Free where there's other sort of co-occurring needs. So they are the 4 focus areas and the 3 fundamentals. The strategy also outlines the governance arrangements for achieving those priorities over the next 4 years, and the subgroups that we are going to establish and continue to sustain for those already established, to be able to break those strategic priorities and those tasks down into tangible actions to achieve those outcomes. And the subgroup information is also provided in the Vowders Free strategy as well. I just want to note as well that the strategy as is being provided to committee today is not how it's going to look as this final version. We have been working with Newport comms to look at how we can produce an animation or some kind of sort of a great shortened version, so it's more easily understandable and sort of a bit more comprehensive then for members of the public to understand, as well as professionals to know what the region is hoping to achieve within the strategy.
Brilliant, that's great. Thank you very much. That's really helpful. Would you like to take some questions?
Yeah, I have 2 questions.
Okay, Councillor Jurett, would you like to go first?
Yeah, thank you very much for that presentation. This is an important area, and what you're doing is really, really good. But just to challenge on a couple of things. On the, I'm looking at the executive summary now, and page 19. And it says, due to regional movements, in the period leading up to and the development of this strategy, there's been a limited evidence base to truly understand local needs. What does regional movements mean in this context? Is it the setting up of the Regional Partnership Board?
No, so that is in relation to movements within the regional team, so the Vowders Free regional team. So there was a significant change in staffing arrangements. It's a very small team anyway, there's only 4 of us in the team, but there's been sort of vacancies and staff turnover.
So there's no data because staff weren't there to provide it.
To collect it and analyse it, yeah. And then also because there has been changes within Public Service Board as well, with obviously the 5 Public Service Boards going to 1, a lot of the data is drawn down from the population needs assessment, and there's been sort of timeliness in that being produced as well. So if the data wasn't available when it needed to be available, then in time with the strategy.
Well, that's, you know. Let me ask another question on data, which is about. Okay, so on page 27, you've got the 5 regions there that take part in this partnership. And then on page 29, let's look at domestic abuse. So you've got about 16,500 victims. And looking back then on page 27, you've got those 5 regions. What percentage of the 16,500 victims of domestic abuse, what percentage occurred in Newport or in the other areas? Because I think it's important to note that they're not all homogeneous areas. Newport's not the same as Blaenau Gwent, for example. And are we delving down into areas or parts of the region where some forms of domestic violence are more prevalent than others?
So in answer to that question, I haven't got the exact percentage, but I'm happy to go away and find out what that percentage is. When the strategy was developed, the 16,500 victims you referred to, that source was Gwent Police in providing that data. Gwent Police data tends to be split over east and west. So, and then obviously we have to get down into ward level and things as well. So that can be quite problematic sometimes to analyse, because it is not always possible to delve into the 5 local authority areas because of how the data is collected. So you can't always consistently interpret it then because of the different sort of ways that's collected and analysed. But what I can do is I can certainly take that question away. I can provide the percentage for you, and I know that one of the, not the police, but there is a capacity within the region to provide it by ward level as well, if you're interested in that.
Yes, thank you. Do you think it would be helpful to the partnership and working of the partnership to have those percentages available to work on? Because, for example, let's take honour-based violence. Is there any difference between the areas of the partnership in terms of percentage of honour-based violence or any of the other abuse categories?
Again, it's difficult to confirm because of how the data is collected within each of the local authorities. So taking honour-based violence as an example, in some local authorities, that's categorised under a generic heading of domestic abuse, but then in other local authorities, it's broken down to honour-based violence. So without going into some of the data sets and scrutinising any further, we wouldn't be able to provide specific data to be able to compare it. But
so just to ask my question again, is there any value in having this data available to you?
There's definitely value in having the data, but if I'm being honest, what's needed is the capacity to interrogate and scrutinise it, to be able to do something meaningful with it.
I think just to add to that, a lot of the conversation we have are about local authorities coming to Amy as the division advisor to ask her for the data, but it's the local authority's individual data. So we sometimes get a bit of a, actually it's your data, it's your responsibility for your area to represent that. And I think within that, certainly in Newport, if you look at our bookings recording system, the way that we report data needs changing as well, because we're not getting the drill down detail that we, so our data, when we look at it, maybe it's like different to what the police are showing us. So it's just about being a bit more savvy from a data analysis perspective to be able to properly represent what we're seeing, notwithstanding, you know, the needs of victims is being met. And we just want to make sure that people are, you know, comfortable in that, because that's absolutely right. But it's just, I suppose, that's how it's represented. That's something we need to work on.
Yeah, I would appreciate that data. Not just for Newport, but for the whole of the region.
Yeah, absolutely. We can request that. Is that okay, Neil? Please. You are wonderful. Thank you. Have you got any more questions, Councillor Jewett?
I have to a certain extent. Or do you want to go on and ask?
No, because we've only got one item. Let's do it tonight. Let's get everyone, you know.
Right. So you want me to? I've got the question.
If you're ready. If not, we can definitely come back to you.
I am ready indeed. Yeah. So on page 34. Is the there's accessibility, and can I ask what's the current budget that you have
for delivering projects? Yeah. Or we get various different types of grants for different things, so if there's something specific.
Well, the reason I'm asking the current budget is that on page 34, there are 5 references to funding shortages or need for more funding.
Yeah.
So, you know, without knowing what the current budget is, and yet you want more funding. So, it's important work. Don't get me wrong. You know, I want to support work that's important. If you're just asking for more funding, but for what projects?
So the budget, in answer to the budget question, we get a grant from Welsh Government, and all the statutory partners within the region contribute to Gowdersby projects in some way or another. So we haven't got a specific budget, it's an amalgamation of lots of different kinds of money. But what the issue we get is the money is only available on an annual basis. So when we are funding projects, we are finding that we're funding for a specific service or a specific need, but within that money, because it's got to be stretched so far, we can't properly and sustainably fund the projects and the services we're supporting.
So what you're saying is that you want more money, but you can't say specifically what it's for.
If the money would be to meet the needs of victims, and that differs on a sort of annual basis. So to give you an example, this year we funded a number of projects. Some of those include a BME, a Black Minority Ethnic Specialist Support Worker to the region. We have funded sexual violence counselling, domestic abuse counselling. There's lots of different, we funded a children and young persons programme as well. So within that funding, like I said, it only stretches so far. So what happens is we end up funding projects, but the projects are not always able to make full cost recovery. And because of that, there are restrictions obviously within the project. So with more money, we'd be able to truly properly resource them and fund them to deliver support to victims.
Sally, do you want to come in here?
Yeah, really, because it was just some of the background in relation to Councillor Drewitt's question, because Amy's actually absolutely right. This is one of the most fragmented areas of funding that we work in. The actual grant that we get for the regional team from Welsh Government is specifically for the strategic work, and then included within that is some money that we can then distribute for some projects. But what Amy's describing is a real tapestry of funding. So what we see is that there are a number of grant funded schemes, some of which sit within the control that we have, many of which don't. And then we have the funding that the statutory partners put in as well. So you get the 5 local authorities, police and health, plus other bits of funding. And you also, in this area of work, get the contribution from, for example, Big Lottery, various comic relief grants. You get all sorts of, I mean, I want to call it weird and wonderful because sometimes that's how it feels, or perhaps more weird rather than wonderful. And I think, I mean, having worked in this area of work specifically in the regional, with the regional biodiversity for the past, gosh, 8-9 years, it is one of those real headaches about how this work is funded. Councillors Druitt's right. Nobody disputes how important it is and the imperative of it, but the confusion over who has responsibility to fund the services means that it is almost constantly on this cycle, as Amy describes, of limping from one grant to another, a 12-month period to another. So it is a really challenging area. So Amy could say that the regional team gets 360,000 for the sake of argument, but actually that's not the budget that is then supporting voucher SV services, because that's made up of various other grants that go to other bits of the service. Now, if I'm having a dictatorship moment, I'm saying, could you just give us all the money? But actually that's not helpful. And I'm guessing some members will be aware the history of voucher SV services is that they've very much come from the ground up. And that has tended, I think, sometimes to contribute to some of the confusion around funding. It is a really difficult area. Sorry, I don't know if that helps, Councillor Druitt.
Absolutely, it does. Thank you very much, Sally. That's really, really helpful. And Chair, I don't know whether you agree with me, Chair, but it seems that this way of funding is not really satisfactory. And I don't know, maybe can I ask Sally what would be maybe a better way? I mean, I don't want to put you on the spot there, Sally, but yeah,
well, Councillor Druitt,
ideally, is there a better way? What would be a better way?
I mean, I think that I'm going to put my heart on my sleeve a little bit here, because I also think that this is one of those areas of work that we in the statutory agencies, we tend to think it's someone else's responsibility. I don't know whether or not Amy would agree, but I think very often it's the local authorities think health should pay, health think the police should pay, the police think someone else should pay. And I think there is some of that goes on in this world because it hasn't been clear statutorily where the responsibility lies. I mean, if I have my magic wand and if I was able to, generate what would be it would be that the local authorities were able to really have sufficient funding to be able to drive this agenda forward in a way that was meaningful. Now, that would be difficult in times of milk and honey. Absolutely. The reality is that at this point in time, with the financial position that we're all working with, but I do think, and I think it is one of those areas of real sadness that it is such a crucial area, such a high level of vulnerability and risk for a significant number of people, with an impact that is lifelong very often. And yet what we see is being reliant on this short-term grant funding, which doesn't satisfy anybody. I don't know whether or not Amy or Finn, whether that is anything you'd add to that, really, in terms of if you had a magic wand.
Yeah, thanks, I probably agree in terms of the magic wand, but just to note for Councillor Druitt that this isn't unique to our region, and so much so that the other regions are struggling with it. The Welsh Government have actually developed a blueprint work stream on sort of sustainable funding and whole system approach to funding to look at what needs to be done on a national level, encountering all the partners that Sally's just mentioned and some more to be able to consider that sustainable funding. But it's not something that can be achieved overnight. So unfortunately, it's going to be, a couple of years before we get the outcomes from that. But yeah, unfortunately, it's not something unique to our region.
Chair, maybe that could be a recommendation from the committee that we look for a way to improve this fractured funding for this particular service.
I think that's probably a little out of our remit in terms of that, you know, I don't know how we would improve the funding, because it's not just Newport, is it? It's Gwent-wide, it's Wales-wide, it's UK-wide, I would imagine, but it's definitely something.
This is such an important
I agree
area.
with you, absolutely. Obviously, I couldn't agree with you more. And as we've got this new 4-year strategy being presented to us, as opposed to a report, I think we can note that we have concerns around the funding model. You know, it's not the council's fault, it's not Welsh Government's fault, it's just, and correct me if I'm wrong, Amy, if you don't mind me asking, with violence against women and girls and this kind of thing, the actual concentration on it is a relatively new thing, isn't it? It's, you know, the depth and the level that we're going to here. I don't mean new as in last week, I mean new as in the last 20, 25 years. I know they've always been refuges, but this level of, you know, getting into the schools, so we're teaching, you know, kids at a young age. And like Sally was saying, this is ground up, isn't it? This hasn't been formulated high up and then this is like built over years. Would I be correct in my assertion there?
Yeah, I think, yeah, obviously refuges have been around for decades, but there's more sort of recognition now, and there's more sort of moving towards a public health approach.
Absolutely, yeah.
In terms of how to tackle it. And Welsh Government trailblazed with the Vouchers Fee Act. Obviously, Home Office and sort of central government have taken note of that, and they're coming in with their policies and legislation as well. So, yeah, I suppose in terms of legislation, it is still in, I don't know, it still hasn't been 10 years. So I don't know if you class that as still being in its infancy.
Yeah. Yeah, and I guess as it becomes more established, more towards the public health sector, we can hope that maybe there's a shift in the budgeting model for it. We can hope.
I think we should mention it though.
I don't disagree. Let's note that. Yeah, absolutely. Any other questions, Councillor Druitt?
I have just one small one, and it's on page 33, and really is a clarification. So intersectionality, and the first bullet point, and it says more male victims coming forward, but still unconscious bias in response. Who's that unconscious bias from?
It's not necessarily from a person or a partner, it's more about a system. So in terms of it, everything we talk about in relation to Vouchers Fee, even, you know, government documents and publications, it all refers to violence against women, and systems are set up for women primarily to respond. So that unconscious bias is in relation to the systems, in that males don't see themselves being able to report into support services or refuges because of that unconscious bias that is set up predominantly around women, because women are predominantly impacted by Vouchers Fee.
Yeah, the name of the legislation says it all, doesn't it? Violence against women.
Yeah, I think that's it. But
Absolutely.
you know, certainly in my experience, men are, you know, come up against.
It's shifting. I mean, it's shifting in terms of, you know, men feeling more comfortable because conversations are happening. Yeah. But it's very early days.
That's right. Yeah. Okay, thanks for clarifying that.
Yeah.
Thank you. Great questions, Councillor Druitt. Thank you very much. I can see Councillor Hussain has a hand up. So, Fazina, would you like to go next?
Yes, thank you. Thank you for that, Chair. Thank you for that report, Amy, presentation. That was really informative. My question is, communities from diverse backgrounds are more, pardon me, at a disadvantage when it, you know, comes to domestic abuse, domestic violence. And I was just wanted to know, looking forward, how are these communities supported? Firstly, because there is a language barrier, and secondly, a lot of them, you know, some of the ladies or whoever, you know, is suffering with the domestic violence are not from this country, they might be from, you know, abroad, different countries. So they don't really know how the system works in the UK. So I was wondering what kind of support do they receive after, you know, they've moved on from the perpetrator into the community. I know you've mentioned some of the funding has gone towards employing some, you know, a safeguarding officer, an officer who actually would support them. But what other support and help do you provide?
So specifically in relation to BME women and those from other minority ethnic communities, as I mentioned earlier, we've got providers that are, that's their sort of expertise or their specialism in terms of supporting those women. But for them to be able to flee their abuser or move on from the perpetrator, there's a couple of avenues we've got. So Welsh Government support with a pot of funding to help get women into refuge where they don't have any recourse to public funds. So, for example, if they come in on a spousal visa or a student visa and they haven't got recourse to public funds, so Welsh Government have a pot of funding that we can tap into to support that. So that takes away sort of an extra added stress then within the trauma of everything around housing. And then once that person is moved safely to a refuge or maybe some other accommodation within the community or elsewhere, we've got a number of services that can provide support with safety planning, immigration status if that's what's needed, sort of family matters in relation to support for children and young people. There's support for continued housing, so if they are in refuge, like what does that move on look like, and sort of sourcing and going through the housing process. There's also support in terms of counselling for any needs that they need meeting or any to overcome any trauma that they've experienced, as well as connecting them with other victims or survivors if that's what they so wish, to sort of develop that peer support, but also embed them in their new community or where their new sort of residents may be, as well as maybe supporting with sort of schools then if you know their parents and children have had to up and leave schools because they've had to move out of the community as well. Within all of that, it goes without saying that victims are able to offer support in their first language or their preferred language. That's primarily provided through BOWSO or Newport City Council's translator resources, and then obviously we can offer wraparound then in terms of referring the victim survivor and or children, if there are any children there, into sort of wider universal services, like setting them up within the new local GP dentist, as well as families first provision or flying start to help resettle them within that new community and sort of move forward from that relationship then.
Oh, that's great. Oh, yeah.
Can I just add, sorry, Chair.
That's okay.
I just remembered as well, from a staffing perspective, what we have done in the last year, we've sought out additional organisations and providers that can enhance that offer of support. So, for example, there's a Polish organisation. They are based in England, but they can deliver within Gwent. And what we've done is we've looked into how that organisation can support our professionals and our Voucher Suite practitioners and translating resources and also programmes, so domestic abuse recovery programmes, for example, into different languages so they can be accessed in that language as well. So they cover support for the victim as well as social workers, staff, etc. to support that victim.
Great, thank you very much.
Thank you very much.
Else?
Yeah, just one other thing. I was the other thing I wanted to know, do you encourage victims to, because obviously with the language barrier, do you encourage victims to access language courses, or is there some like in-house courses that you might offer them in, for example, a refuge or with some of the partners you work with? Because it's just, you know, to help victims to step on the ladder for independence for themselves, not having to rely on neighbours or friends, and actually be independent and not having to rely on interpreters as well. Is that something that you encourage as well?
I can imagine. I can't answer that for definite because I'd have to go out and ask the frontline services. But given the case studies that I read as part of the contract monitoring for the grants that we provide for the project, I know that there are links to local colleges and sort of community classes where people can learn English, and that's offered through immigration services. BOWSO offer that support as well.
Thank you.
That's great. Thank you so much. Thank you,
you,
Councillor Hussain. Councillor Morris, do you have any questions you'd like to ask on the report?
Actually, Pat Druid, and I obviously think very much alike, because Pat Druid asked many of the questions I would have liked to answer. We were obviously reading the same pages. I've got a couple actually. Looking at the figures, they're quite astonishing. Unbelievably sad to see them at the size of the figures. Would I be right in thinking that there would be a direct relationship between the areas of deprivation and the numbers of incidents? Is there a correlation between deprived areas that would get more?
Not necessarily. So historically, there might have been. I can't say without looking at the data. Historically, there might have been, but what we have found since COVID and the cost of living crisis, that we are seeing all classes of families and individuals and those in relationships now experiencing or being impacted by some kind of vouchers fee. So just as an example, you know, sort of those pre-cost of living that might have been quite well off, or, you know, sort of middle class, the pressures associated with the pandemic and cost of living, possibly losing their jobs or extra financial worries then, because of both of those things, they may be, their relationships may be changing as a result.
Exactly. The pressure on.
So yeah, the further pressures within sort of finances within relationships means that there's more abuse then becoming prevalent in those relationships. So historically we may have seen that, but what we are seeing now is that you can't really correlate at all, because it's affecting or being impacted for everybody.
I think there's something to be said as well for looking at deprivation. Deprivation generally means that you're living more densely together, so you've got more people listening, you've got more witnesses, you've got more. Whereas if you're living in a more leafy suburb, for example, with less neighbours, so we can understand why it's been underreported. I don't think it's ever not been an issue. It's just about who hears, who sees, who does something about it. And I think as conversations evolve through the implementation of these sorts of strategies, people are going, actually, that's not okay. So I think it's creating more of a conversation to allow people of all classes and sectors to be able to go, that's not acceptable. And, you know, workplace policies around, and on the back of all of the toilet rolls, you've got the live free. So I think there's that kind of rolling momentum of making sure that people realise that you know, this is harm, this is abuse. It's getting out there more, which obviously is impacting on the numbers, but arguably that's a good thing that people are coming forward with owning a situation which is causing harm.
Sorry, just to add to that as well, I think as well, Welsh Government and their strategy are very focused in their sort of comms and their messaging around that subtle identifying and responding to vouchers fee as well. And I don't know if anybody has seen it, but I would encourage you to take a look at their sound campaign that they ran earlier this year. And they're going to run another campaign as part of it now in the summer. I can provide the links to share if helpful. But again, that's about that sort of low level messaging around what's healthy, you know, what's unhealthy, abusive, not right behaviours and things. And that is prompting more conversations within communities as well. And because of that education and that communication, people feel more empowered to challenge and call it out and say it's not right. So we've got an increase in reporting as well, which can capture data. You know, it's hard to sort of pick apart that.
No area is under more pressure than the housing sector. How does that affect you and your ability to get people housed or moved over there quickly? Have you seen a big change in that during the downturn?
Yeah, so housing obviously massively impacts and sits alongside house fee. We've got, and I'm sure Finn and Sally could speak from a social services perspective, where you've got a perpetrator living with a family, and then if that can't be happening, you know, that perpetrator may end up becoming homeless, or the victim and the children have to move on. We've also got obviously a huge shortage in terms of bed spaces in refuges as well, which housing support and to look after. And then there's just like a housing crisis generally, isn't it? But it's difficult because it's not just about having the housing places, the beds or the stock available, because whilst even if that was the case, it was available, you can put victims and survivors safely into those houses or those spaces, but you need the support to go with it. So it's all kind of had a lot of stress, for want of a better way of explaining it. Yeah, so and it comes back to the funding that we mentioned earlier about sustainably funding things. Housing funding is on a different time scale and path, so they get different money, so it's harder to sort of come together and do things with it then.
Then more slowly into it, so what comes back to funding.
Yeah.
Fantastic report, huge amount of work has gone in this, and it's just incredible read. How much input have your clientele actually had in putting the report together?
So I met with, Gwent has a number of victim survivor groups. They sit within, they looked after within different providers and different organisations. But for this report in particular, I met a couple of times with the survivor group that Gwent Police look after. And they were very important in terms of, there's a section on what they put forward and the changes they want to see within the region. They are an established survivor group, but what they do is we regularly keep in touch with each other through the survivor engagement coordinator in Gwent Police, and we do, as well as what we do in the big pieces of work then in terms of influencing the strategy, we also work on smaller projects as well, so they are holding us account to what we promised in the strategy too.
Your work.
Thank you.
Thanks, Chair.
Thank you, Councillor Morris. Councillor Screen, do you have any questions?
Yeah, thank you, Chair. Just want to say that I think it's appalling in the 21st century that we have this issue where, you know, 50% of the population are subject to this sort of thing. And I can only commend, you know, the way that this is set up and the work that it's doing. You know, it's doing such a great job for that 50% of the population. Yeah, just a question I wanted to ask about agencies working together. I noticed that there are a number of different agencies involved. How do you sort of manage, you know, the actual number of agencies? You know, how is that managed?
So in terms of the agencies, Councillor, obviously we've got statutory agencies and what we call the specialist sector, which are our group of specialist vouchers fee providers. And we're really lucky that we have very committed partners and agencies to Bowdesby in the region. The relationships are primarily managed through the Bowdesby regional team, so that's myself and the team. But as part of the commitment from agencies, they sort of allocate then or dedicate a particular person to a theme or a meeting or a group that we're having across the region, so we can ensure that there's representatives from everybody within each of the meetings or the groups we're having without absorbing capacity of a single person. And that obviously also supports skill base as well, and then, you know, focusing tasks at the right level with the right people. So we've got commitment on our Bowdesby board from our senior leaders, and obviously Sally chairs that. And then that goes right the way down then to our subgroups and our sort of task and finish work, as well as our day-to-day work, even just doing things like tweets on social media, how we all come together is primarily through that dedicated resource identified or that dedicated person identified within each agency.
Okay, thank you. Just another quick question, Chair, if I could.
Absolutely.
Is that okay? Yeah, what about the role of education? Because I know the curriculum for Wales now includes different age groups, you know, looking at personal relationships and so on. I mean, obviously that will take some years for it to, you know, hopefully become effective. But are there any links between yourselves and the education sector?
Yeah, so on a regional level, we have what we call a whole education approach subgroup, and that subgroup is made up of education safeguarding leads and healthy schools coordinators, and they work as a group to provide and ensure that the Welsh Government guidance for schools in relation to Bowdesby is updated and relevant, not just to the region, but to each of the schools that they're linked to. And then obviously that sits within our Bowdesby governance structure. And we've also got Sarah Morgan, Head of Education in Newport, who sits on the Bowdesby board as well. So that's how we sort of link it in on a regional level. And then the Welsh Government have a blueprint work stream, and education within Welsh Government is sort of represented through that work stream then. So it can feed both ways in terms of our influence in our regional practice to make sure it's fit for purpose and relevant, but also make sure that Welsh Government is supporting that then from the sort of direction down into schools and education.
Okay, thank you. Thank you, Chair.
Thank you. Thank you. Thank you, Alan. Bev, I'm just going to ask my question next because it kind of ties into what Alan was saying. So I read a report from the summer from End Violence Against Women that found that a third of girls think that schools wouldn't take it seriously if they reported sexual harassment or misogynistic behaviour. So as well as working with the kids, is there recognition and support and support for the teachers and for the governing bodies to put in place policies, you know, and you know, from my own daughter's experiences in schools, I know they've both been subject to misogyny, and one of them particularly had a bad sexual harassment case, and the school dealt with it brilliantly. But as this becomes more prevalent, what support is there for teachers from you guys?
So in terms of support, up until this point, we run dedicated education training sessions for teachers. And through the whole education approach subgroup and the education safeguarding officers, they link really closely with the designated safeguarding leads and the pastoral leads to sort of maintain those links for that support in responding to those concerns or allegations within school. But as you've just mentioned, this is becoming more prevalent. And there was also an Estin report that was published earlier this year as well about sexual harassment in schools. And this is what has led, you know, that this is what supported the informing of the strategy in terms of misogyny and harassment being a focus area. So going forward, under that focus area for the next 4 years, what we're looking at is not just consistently training teachers and school staff, around misogyny and harassment, but also, as you said, what do we need to do to put that support in place and where the gaps are for that support, but also looking at how we can influence workplace policies. So it's all a very new area for us.
Absolutely.
But we're hoping that given the local authority, the local authority's commitment with sort of HR representatives and things, it's a piece of work we can start to do now and hopefully get somewhere within the next 4 years with it.
Brilliant.
Just to add to that, Councillor Chair, I'm keen to kind of emphasise that part of my remit is to cover education safeguarding as well. So I can be the joint between these sort of different elements, which really make. And for example, in the hub in Newport, we've got 2 education staff sitting there to take calls from schools when there is issues arising, to be an advice, not just put us into but giving advice. Schools have been really receptive of that and really find that incredibly helpful, probably more helpful than it ever has been. So I think we can see the gaps and we're doing our best to kind of overarch and plug them as best we can with a service to proportionate.
I can see that. I'd be really interested if there's anything, you know, to monitor the progress. And obviously we will through scrutiny, but, you know, I'd be really interested to see how your journey goes with that, because I think it's so important and so new, you know, like we say, you know, especially after lockdown. I think that, yeah, thank you very much.
Just on that note, I was just going to say the whole education approach group meets termly. So if you were interested in joining that meeting to get sort of an update on progress outside of annual scrutiny, you're more than welcome to.
I would love to. Thank you very much. That would be great. Thank you. Councillor Drew, is that on this point or is it on another point?
It's actually on another point.
Can I take just check in with Beth first and then come back to you? Would that be okay?
Certainly.
Brilliant.
Sorry.
That's okay. Councillor Davis, do you have any questions?
Yeah, I mean, some of my questions have already been answered. And yeah, I find it a brilliant report. And what I love about reports that come through scrutiny is where they have actual voices of people that you've helped. In this case, you know, some survivors' feedback. What I noticed though as well is, like you've said, the lack of feedback where men are concerned. And I can understand that it's only the last few years that men are actually coming forward and admitting that they are on the receiving end of domestic violence. What I wanted to know was, obviously you hear of women's refuges. Are men's refuges available? And what is being done to encourage men to come forward and to receive the help that women get?
Thank you, Bev.
Thanks, Councillor. So on the note about men's refuges, they are available. No, unfortunately not in our region, but we have very limited refuges in our region anyway. So like most refuges, for victims seeking refuge, they have to travel outside of the region to get that bed space. So yes, they are available. In terms of the support for them to come forward, on a national level, the DIN project is doing sort of their primary work and their primary purpose is to support men in coming forward. So they sort of target their communication, their messaging, their promotion all around, you know, it is geared to men then specifically. We have looked to see how we can work with them in our region as well. So we can make sure that not just the projects we fund through the Welsh Government Vouchers Fee Grant, but projects generally, I know this is a bit dumb, but look like accessible to men. So when they are looking on websites for support, they can see themselves represented in those websites or those organisations, despite possibly a female or woman focused name or sort of suggestion. So one of the new subgroups that we're going to establish under this strategy is previously we've had a honour-based abuse leadership group, but recognising things around men and what I said earlier about the unconscious bias, we've sort of reviewed that subgroup, and we're going to change it now to include protected characteristics. So not just males, but also people with disabilities, LGBT, they see themselves represented in those services. So it breaks down the barrier then, and it supports that accessibility in sort of making that phone call or knocking on the door or coming forward.
Yeah, thank you. I mean, there's always been a lot of emphasis on women that are victims of domestic abuse and everything, but very little with regards to men. So I'm pleased to see that things are changing in that, for a good direction. Another thing that I wanted to mention as well, that I'm pleased with the regards to cohesive and controlling behaviour is also now being looked at. What I'd like to know, though, basically on the back of what Councillor Corton has said, is that with regards to going into schools and liaising with high schools and the older children with regards to tackling cohesion and cohesive behaviour, that they are what's the word I'm looking for, that they receive. Do you understand what I'm saying?
That they
Do you mean that they know what they're looking for? The teachers know what they're looking for in terms of that?
No, more so if, well, yeah, the teachers as well, but also like with children is especially sort of the 11 to 18 age group, where I've had a situation recently where my grandchild has been put in a position where she was on the receiving end of coercive and controlling behaviour. She is actually in high school, and she couldn't understand that was what was happening. And I wonder if others are the same. Sorry, I lost my picture. Other children are the same, is that they're not aware that they are the recipient of coercive and controlling behaviour.
I guess it's that educational relationship, educational thing, isn't it? The difference between, oh, he loves me and, oh, this is over the line kind of thing. Is that what you mean, Bev?
Yeah, and I think it needs to go into schools and to be able to talk to them and be able to explain better than I can about this sort of behaviour and the fact that it is unacceptable. So I'd like to know if that is are you doing that sort of thing with regards to going into schools? So
in regards to education, Welsh Government fund a programme called Spectrum. Spectrum is delivered by qualified teachers, and it meets all the sort of curriculum objectives, and they go into schools and they do that work, and they do it from age 3 up to age 18. So Spectrum go in and do specific sessions as part of sort of pastoral learning with year groups. So to give you an example, there was a school in Newport the other day, which I attended, and Spectrum went in, and for the 8 lessons that day, they saw everybody in year 9, and they did a specific session around sexting, grooming, sort of unhealthy behaviours and things to sort of like look out for in terms of online exploitation and abuse. So Spectrum are commissioned by Welsh Government to do that work, but obviously they are a finite resource. So we are trying to support that agenda and that programme as much as possible through our campaigning and our sort of comms messaging under the whole education approach subgroup. So that feeds into schools as well. So we're trying to cover it from more than one angle.
That's brilliant. Thanks for letting me know that. It does. It is heartening to know that is being talked about in schools. So thank you very much. And again, thanks for a great report.
Thank you.
Thank you. Councillor Druitt, did you have another question?
Well, yeah, I just want to follow up on what Councillor Bev Davis was
Sure.
saying that coercive behaviour does go on between children, and it's difficult for children to recognise that it does go on. But maybe that's where the parents and grandparents come in and try and explain to children. So it is an issue that certainly has affected my family personally. But let me ask a follow-up question, please, to what Councillor Morris was saying, and it's about perpetration, really. And is there a link and between societal between what society accepts as norms, for example, in use of alcohol, say, and perpetration of domestic violence, and what's what's going to be done to tackle that, if there is a link?
I can't categorically say that there is a link. There are many perpetrators who consume alcohol on a recreational basis and, may be dependent on it as well. But what we are looking to do within our region, coming back to the focus area on multiple and co-occurring needs earlier, is we've established closer working relationships with the Substance Misuse Area Planning Board, who commission the alcohol and substance use services across the region. And we are definitely looking at, we actually run a session in September with practitioners across the region to look at what the presenting needs are in relation to maybe causal or consequence factors, and what we need to do to put support in place and how we can respond to those presenting needs, as well as what will sort of be like a gold standard in mitigating or minimising them. And myself and the lead from the area planning board are meeting week after next to go through all that feedback and consider it. But there is a recognition that sometimes alcohol and vouchers fee are connected, and so we need to come up with a strategy for addressing that or putting interventions and support in place around it.
Is that the same, this link between domestic violence and other uses of drugs other than alcohol?
Yes, it would. So when we talk about substance use, we're talking about alcohol and drugs.
Fine.
Yeah.
Thank you.
I think also some work I've done previously is around the nighttime economy and some of the messages that go on within those settings that, so bystanders calling out stuff that isn't acceptable. And the more of those conversations that happen on that level with your friends, mates saying that's not okay, that's the normative way to deal with things. It's not escalating to something horrific happens.
Well,
so we're generating those conversations, which I think is really, really important.
absolutely. It's a societal thing.
Yes. And it's not just, I think it's everyone's responsibility there, but like safeguarding, isn't it? If you see something, you need to do something about it. How you do that, it sometimes takes courage, I get that. But actually, if you see something, and I think the more you see things on buses and billboards that say, pull it out or whatever, the more empowered people should be to be able to manage until they see that they don't think it's okay.
Yeah. And again, on the Facebook and that sort of TikTok and all of that, that new media, to me anyway, new media, that there's a danger there that things which are violent become acceptable because people see it, but it's not.
Thank you, that's great. Thank you, Councillor Druitt. Does anyone else have anything else? No? Brilliant stuff. Well, thank you so much for taking the time to come and see us this evening. That was really informative, and I think the work that you guys are doing is great amidst the difficult financial backdrop, shall we say. So thank you so much. Thank you so much.
Thank you.
Thanks for your time.
Thank you. Keep up the good work.
Thank you so much.
It's Christmas.
Yes.
Thank you.
Yeah, Merry Christmas. Oh God, I keep forgetting. Oh goodness.
Alan
So-
hasn't. No.
Oh, can't wait to see what he's getting us all. Right. Shall we move on to comments and recommendations? I know we picked a few up. Neil, I picked up. Oh, I'm not on mute. Can you hear me?
Yeah.
Yeah.
Yeah, oh, it's telling me I'm muted. I picked up that I agree with Councillor Druitt that we should put down notes somewhere about the concerns around the funding model and the sustainability of the service deliverability, given where it is, and that we hope that this will change in future years. Pat, would you agree? Obviously we do.
Absolutely. Yes, completely.
Yeah, absolutely. If we could, sorry,
I
Neil.
think it's one of those areas that really should be ring fenced, isn't it? You know,
Yeah, I agree.
all areas are coming under attack, but this really is, we got many priorities, but this really is a priority area.
If we want to be a civil society,
The people that need this service, you know, cannot do without it.
I think what's interesting about it, and I don't know if members will agree, is the number of our services that it crosses. So it's not just social services, it's education, it's health, it just crosses, so, you know, everything that we do really. It's, you know, when you, it's not as it was 30 years ago where it was refuges. It's just so huge now, and the work they're doing is, the scope of it's just massive, isn't it? It's just incredible. Let's see. I also said, I've also noted, and I don't know if members agree with me, that I'd love to see the final report and the assets they talked about. They were creating animations and things like that, and I'd love to see those when they're ready, if that's all right, Neil, if we could ask them to send them to us, because I think that's important. I asked if I could follow the progress of the school, so I think they're going to invite me to those meetings, which would be brilliant. And I'm sure if anyone else wants to come along to those, they'd be most welcome. Not my meeting, can't invite you all, but I'm sure it wouldn't be a problem. What else did you have that we noted, Neil?
I've got noted that committee thank the officer for attending and for the huge amount of work that's gone into it. They appreciate it. Councillor Davis made comment that it was good to see the actual voices of those who have helped, such as survivors' feedback. Councillor Druitt requested the percentage of figures.
Oh yeah.
So Amy's can say she can get a percentage of figures back to the committee and ask for ward level if the committee would like that.
Do we want ward level?
Well, it would be handy.
Okay.
It would be
If
handy.
it's available, I think that's interesting.
Yeah. As well as global
Citywide,
Newport, blind lanes and so on.
I don't break down the figures.
Yes, breakdown of figures.
Mentioned committee's concerns about the funding model for the service, hopefully a shift. Amy comment as well as sorry, got wrote down as well. Welsh Government under their strategy very focused on communication and messaging around subtle identification responding to violence. They mentioned about the sound campaign, which is running another this year. She can provide the links to that.
Yes, so we need that link.
Was there any
and
other
the
comment?
Spectrum campaign was quite interesting as well. The Welsh Government programme. I was interested to hear about that they're delivering in schools. That sounds really great.
Yeah, I was pleased about that as well.
Yeah,
I
it's so
think
great.
it's like Pat said, though, that young adults don't tend to listen to us parents and grandparents, whereas in school, they're more likely to listen.
And they're more likely to speak to them on a level that maybe as parents or grandparents we might feel a bit awkward about as well.
Exactly.
You know,
yeah.
having conversations about sexting or pornography or whatever is difficult as parents and grandparents, isn't it? So
Yeah, exactly.
I think that's brilliant.
Chair,
They did. Oh,
Chair, can I suggest should we ask the housing associations that they should work together so there's always at least one of the housing associations has a property available as emergency accommodation for people requiring it.
I don't think, given that they just presented their 4-year strategy report, I don't think that's a recommendation that we could push through. That's some work that they would do, and it's not something that we as a committee can ask the housing association to do either. It's a great idea, Al, but and also I'd imagine, and Fazina, I know you've had experience in this space, having one specific property where a family could go, word gets around that that's where the family are, and maybe it defeats the object. Would you agree?
Yeah, I mean, what normally happens is it's like multi-agencies, they try and find refuge, or it's mainly they try to place families in a refuge where it's and obviously it's going to be in a different location from where they are, because they could be in England and then move to Wales. And like you said, just having one property just dedicated for, you know, issues like this, yeah, it is quite a safety risk. And I think the refuge, a lot of the refuge that I worked in, they you know, they are very, very strict when it comes to, you know, disclosing the address, you know, and they make sure, you know, all of their residents and the victims sign contracts, and if they do go against or break the confidentiality, then it's very, you know, it's very, they are harsh on them. They actually ask them to leave the refuge, and it's happened in many cases.
Thank you.
So yeah, it's, yeah, I think just a refuge which is not disclosed is a better option.
Thank you, Councillor Hussain. They did ask that we endorse their report, and I'm minded that we do, because I think the strategy, I'm more than happy to endorse this strategy. Does everyone agree?
Yeah.
Excellent.
And I think they should be congratulated on it.
Oh, I think they should be carried aloft, and because you know, the work they're doing is just, you know, and especially, you know, in 10-15 years time, hopefully the next generation will see this huge shift, hopefully an end to, you know, misogyny dying out and sexual harassment, and, you know, who knows. I wish them all the well.
Let's work for a reduction, you know, I think.
Go big or go home, Pat. Right, Neil, is that enough? Is that everything you need on that from us?
That's it, unless there's anything else the committee would like me to add, we can take this back to officers.
What's the wording, Chair, that we're going to use on the funding bit? Do we know?
Is there any particular wording like
Well,
that?
I think we need to be fairly strong on it, you know.
I think that it should be noted that the committee would like to see the development of sustainable funding for this provision. And I think that's all we can say, because we know the position. We know the position that the Welsh Government, we can't recommend it because this is a global problem. This isn't a Newport problem. But we know the position. Oh, can I just finish? Thanks. We know the position that the Welsh Government is in due to cutbacks. You know, Welsh Government is £900 million down this year based on the, you know, due to inflation. They're projected in real terms to be. We know the impacts our council has had. So at the moment, the grant funding from the big lottery and from Save the Children and Children in Need, whoever they get in it from, is essential. So we can't say we want that to change now, but we can say that we'd hope to see it, and that, you know, we'd hope that that's explored for the sustainability of this ongoing incredible work. I don't think we can recommend that that's changed, because that's just words, isn't it?
Chair, can we not express concern about the sustainability of the funding? We can during the present revival. Should we not express?
How do members feel about that?
I think we could note, Chair, we could note concerns. We could note that the committee has concerns. Yeah. That's about as far as we can go, really.
We note concerns because we want to see this continue. We don't want the future of it to be in jeopardy.
Let's be honest. Sorry.
And we did. I wouldn't go that far. You know, they have got, although it feels like it is bits and pieces put together, they are receiving the funding to deliver the projects at the moment. I don't think it's alarm bells that it's all going to disappear tomorrow.
No, alarm bells are ringing amongst ourselves. at the sustainability of the funding, having heard what we've heard today. So we can express concern about that.
We can express concern, but I think we know the funding is there. It's just the way that it's funded at the moment. Remember, they talked about this patchwork of funding, and I'm sure their life and their work would be much easier if it wasn't so much of a patchwork of funding. But you know where we are with public spending and public finances at the moment, we all have seen that. So yes, Pat, we should. I think Alan's right. We should note our concerns, and we should hope that the funding becomes more stable when the time is right. But as Sally did say as well, in times of milk and honey, it would be hard to give it one big funding stream too. Are we all happy with that?
Yep.
Yeah, excellent. Okay. Shall we move on to the minutes of the last meeting, Neil?
Yes, please, Chair. Okay,
does anyone have any feedback on the minutes of the last meeting, which is the meeting of the 8th of November? So who was here? So Fazina, Alan, Bev and Pat. Anything on the first page of the minutes?
No, Chair, they're fine, good,
Second, yeah, you're happy with them, Pat. How does everyone else feel?
Yeah, that's fine.
Yeah, Alan, Fazina, Bev, all happy?
Yeah, happy with them.
Nothing obviously.
Brilliant. They're passed then, that's wonderful. And then the forward work programme, please.
Just to update the committee chair, the next meeting is Wednesday, the 7th of February at 5 o'clock. We'll be discussing the area planning board substance misuse service. This is the first time that they provided a report for the partnerships committee. And the SENCOM regional support services for schools has been removed from this agenda. It'll be put on the draft annual forward programme later on this year. So when we have an update on that, I think the head of education mentioned this should come around June or July's meeting. But of course, when we discuss the committee's forward work programme for the coming year, we'll give you some more news. And then the meeting after that, Wednesday, the 8th of March at 5 o'clock, we've got a Safe for Newport update and the EAS value for money.
Excellent. We're wishing away 2024. We're talking about March already.
Yes.
That's wonderful.
The 8th of March.
Gosh. Okay.
And then so I've got the 6th. Sorry for that, and I'll update that. Also, just a note, Chair, as well, in the forward work programme, we've also on Wednesday, the 28th of February, there's I think I've already sent calendar updates to the committee, but we've got the Barnardo's partnership coming.
Wonderful.
To discuss their current contract and the work that they've been doing. So we'll have Bernardo's contacts coming in for that, and also Sally Ann Jenkins, Studio Director, will be coming to that meeting as well.
Thank you very much. That's great. Well, I think that's it for this evening. Thank you all for attending, and anyone that's watching, thank you. And Neil, can I just say on behalf of all of us, thank you so much for your hard work and everything that you do to support us in this committee. It's really, really appreciated.
Hear, hear.
Thank you.
And I hope you have a lovely Christmas.